You're listening to the True North Success Podcast. Real stories of personal, professional, and financial wins from Alberta's best. With your hosts, Gary Ma and Amy Kim.
Hello, everybody. Welcome to the show. Today, my special guest is Uche Nwadike. Dr. Nwadike is a very accomplished healthcare leader and entrepreneur with over 20 years practicing across the world, including Africa, the Caribbean, Europe, and North America. He practices in family medicine, addictions treatment, public health, independent medical examinations, disability evaluations, and immigration and visa medical services. Dr. Nwadike is currently the president and CEO of Zomac Medical Group in Calgary, Alberta, where he leads a team of over 20 staff members. Dr. Nwadike is also the medical director of the Griffin Road Medical Clinic, which is a neighborhood practice in Cochrane, Alberta. And in 2024, he received the Alberta Immigration Impact Award in the Entrepreneurial Spirit category for demonstrating leadership and innovation in association with the Griffin Road Medical Clinic. It is my pleasure to have Dr. Uche Nwadike on the show today. Welcome to the show. So,
Thank you.
Dr. Nwadike, I gave a quick overview of your success, but can you fill in the details of what your businesses are all about, who you serve, and how long you've been doing this for?
Yeah, thank you for having me. So my name is Dr. Uche Nwadike. I'm a family physician who is building a who operate multidisciplinary clinic across Calgary and Cochrane. We are on a mission to integrate healthcare in a way that primary care, rehabilitation, and home care are in a coordinated team so that patients are not falling through the crack when they are discharged from the hospital. So ultimately, we are connecting primary care, rehabilitation, and home care in a community-based model.
Nice. So in your businesses, what sets you apart from the competition? What comes easy to you that others might find challenging?
So what sets us apart is that we are thinking of solution. So we see problem, we solve it. And how do we solve the problem? First of all, we build a strong team. We build a strong team, then we build structure, then we build healthcare model that serves the need of Calgary families, the seniors, and the diversity of Calgary. So we're innovating, bringing in technology into what we do. We are bringing compassion into what we do. We are carefully selecting individuals, not just renting room to random people, but meeting together people who align in culture, in value, who believe in patient-centered care. So we're bringing them together because if you have a strong team, a good culture, then patient outcome is always better.
Right. So like with right now, I believe you're running a clinic in Cochrane. You're also running a clinic in Calgary. What tips or suggestions would you give someone who wants to be more successful?
So for a physician who want to be successful, first of all, I would say do not start with logo. Start with solving problem. You need to think of what problem am I going to spend the next 10 years trying to solve. That's number one. Number two, mentorship. You need to ask for help early. Nobody gets extra credit for doing things alone. So you need to, seek mentorship. People who have made the mistake, have learned from their mistake, and now successful. You need to do that. Number three, you need to understand business, cash flow, HR policies, government policies, and then you need to build a strong team. Very important. And then delegate, because you have to trust people. As a strong leader, you have to trust, we have to delegate.
Right on. So with that in mind, like through all your delegations and dealing with people, what's one of the biggest challenges that you've had to overcome in your career, and how were you able to turn that into a positive?
So one of the biggest challenges is number one, worrying whether you're making the right decision. You know, as a physician entrepreneur, you may have to take a loan to start a clinic. You'll be wondering, is it the right thing to do? And then, very importantly, you need to, develop a system that works. What we have too often is where patients are chasing the system or trying to navigate the system. You need to build a system where you need to build in the healthcare network where the system surrounds the patient for a better patient experience. So building a system has been challenging, but once you master it, it makes everything work well, which is what we're trying to achieve, because healthcare leadership is stewardship. So essentially, if you have a good leadership, patients have better experience. So and we have, over the time made some mistakes and we've learned from them. And that's what we're trying to do the best for our patient.
Right. So in your experience, like, how did you learn about the business side of, from being a medical doctor?
So I had good mentors to start with. Number two, I have to take some education. So, do some education to get the basis of running a business. And then some of them I have to learn on my own. As you go along, you start small, then you grow big. What I see is if you're passionate about something, if you're out to solve a problem, then you're inspired to go learn more about that problem and then design the solution. And that's what I've been doing. So I've attended conferences, I've read books, I have attended courses, and that's what, and then mentorship. Yeah.
Right on. It sounds like things are going really well for you and your businesses. A lot of health professionals are looking towards the future at how they can create income outside of their business to increase or even replace their current active income. What are your thoughts on this?
For me, wealth is an option. And so for a healthcare business, I think there are some key things to look at. Number one is I believe that a strong business model is necessary for providing ethical, sustainable care. And so for sustainability, you need to be creative in terms of how you get this funding, but to keep the door open so that patient can be seen. Number two, you need to innovate. So if you're able to innovate in healthcare, you need funding to do that. And so that is wealth for me in healthcare. The ability to be able to fund innovation, the ability to keep the doors open, the ability to select the top talent and be able to pay them. So in as much as diversification is involved, whether you want to do medicine or go into other field, it still boils down to your passion. And doing medicine is my passion. So I believe that if we have healthier patient, healthier community, then we're doing well.
Right on. In 2024, you received an award for entrepreneurial spirit. Tell me a little bit more about that.
So, when the Ukrainian-Russian war happened, there were a lot of Ukrainians who were fleeing from adversity from their country, and a lot of them came to Calgary, came to Canada, a lot of them came to Calgary. And generally here, you have to have, employers tend to ask, do you have Canadian experience before you get job? And for us, it was compassion for us, seeing people fleeing adversity. And as an immigration panel physician, I encountered so many of these people. And so we didn't insist on Canadian experience. We gave them Canadian experience for them to have that first job and be able to go make a living here in Canada. And the other one was, but before then, when we were setting up the Griffin Road Medical Clinic, the primary care network has closed their clinic in Cochrane. And so a lot of the doctors left, and that created a huge gap in that community. So we saw an opportunity to go and help. And that was how we engaged the community leaders, the MLA, the mayor at that time, and we had conversation. How do we come in here and fill the gap of these doctors? How do we create a multidisciplinary clinic that meet the needs of the community after hours, weekend coverage? And that's what we did in Cochrane. And I'm happy the clinic in Cochrane is doing very well.
Right. So it sounds like you saw a problem and you created a solution through creating this clinic in Cochrane, which led to the award, and that's fantastic. And as we're wrapping up our interview, what exciting plans do you have in the works in the next 6 to 12 months?
Yeah, so what we're doing now is we are building because our mission, like I mentioned in the intro, is to build this integrated community-based care where you can coordinate activities from the hospital discharge to rehabilitation to home. For instance, let's say an elderly lady fell at home, broke her shoulder, while in hospital was found to have irregular heartbeat. On discharge, she needs to see her family doctor, internal medicine physician, and rehabilitation. So what we're building over the next couple of months is to get it integrated under one roof, where this elderly lady, for instance, can see her GP there. Instead of driving across the city to see internal medicine specialist, we see internal medicine specialist in our location.
Okay.
And then get her rehabilitation there. So we want to show people how integrated care could work and how it could better patient experience. That's what we are focusing on doing over the next couple of months to give patient better experience.
Okay. So is that going to be in both the Calgary location and in Cochrane, where you're going to create integrated care facilities?
Yeah, so what we plan to do, we're going to do a modular rollout. So we will start with one location.
Okay.
And then we will do it in another location. But our specialists that we're bringing in to join our team, we're in discussion to make sure they rotate around the location. So they might be in Calgary today or be in Cochrane tomorrow. So whoever is in Cochrane does not need to travel all the way to Calgary to see an internal medicine specialist. So in that way, we're bringing care to our communities and attending to their need.
Right.
And that's what I mean when I said we need the system to surround the patient rather than the patient trying to, work the system.
So that's quite a unique healthcare model then, would you say?
Unique in the private sector because most you see such things set up by the government, like the PCN used to have one in Cochrane, which they shut down now.
I see.
I don't know. So we're trying to take it private and see how we'll do that in a way that other people will emulate and patients will be happy for that.
Right on. Dr. Nwadike, that wraps it up. And thank you so much for your time today and sharing your insights and tips with us. It was a real pleasure to have you on the show. And Dr. Nwadike, if people want to connect with you, what should they do?
People want to connect with us can email us if you're interested in partnering to see integrated community-based care, or you want to understand what we do more. You can send us email on info@csnmc.ca or on my LinkedIn page, Dr. Uche Nwadike, and we can connect from there.
Right on.
Yeah.
Thank you so much. Really appreciate it.
Yeah. Thank you so much.
Want to share your success story? Apply to be a guest at truenorthsuccessshow.com/guest. We'd love to hear from you.